Hello everyone. I want to start this presentation by thanking all the participants, all the panel members, and my dear colleagues. So, before that, I especially want to thank the organizers of Longdom Conference for conducting this conference and also giving me opportunity to present my some work over in front of you. So let's get started with today's topic. Today we are going to talk about the role of influencers and targeted marketing and how it can be utilized in public health. So let's get started with this topic, this presentation. So we are all aware about social media marketing or the social media and its presence in our life, whether we are a medical professional or we are a patient. We all have some role of social media in our day-to-day life. So when we are working on social media, we should be diligently and carefully using how this social media can benefit in betterment of the society at large. So to understand this, we need to understand few concepts related to social media marketing. There is something called as a healthcare influencer. So these are typical influencers on social media. Usually they are individuals. They are not representing any organization. They are usually working on individual basis and they have typically a large number of fan following where these influencers are promoting some kind of health and wellness topic. They provide some tips or ideas, or they are promoting various products and services related to health through their content. And when I say their content, usually it's some kind of blog, written blog, textual blog, or some video content, or just maybe some social media posts. Through this content, they usually engage with their target audience, and this fan following is so much strong. Usually, they inspire the audience to take some kind of action. So whether it's changing some kind of habit or maybe buying some kind of product or service. So there is another concept called as a targeted marketing. So targeted marketing is nothing but much different type of marketing strategy where usually the businesses or the organizations they focus their energy, their marketing efforts, and all the communications in a particular fashion targeted to a particular set of people or target audience, or we can say the consumer of the product or the service. And it could be either a specific age group, it might be some children group, or might be some older population group, it might be just directed towards women group, or it might be related to particular locality, a particular city or particular country, or it might be related to some particular spending habits or particular type of interests, passions, hobbies. So there can be different variations or categories of this kind of influencers. And these marketing campaigns are usually designed in such a way that it will reach to a specific audience, and it is more powerful as compared to the traditional marketing approaches. So involving this kind of segmentation, those kind of smaller groups helps to target in better way, in better fashion. So when it comes to influencer marketing, it's nothing much different than a word of mouth marketing. It's just only in more of a digital or online version of word of mouth marketing, because when you like certain product or services, or maybe you're following some kind of passion or hobby, you obviously like to share with others. So that's very natural human phenomenon and tendency. So that similar thing is happening in online world, and that's why I always say that healthcare influencer are more of a infotainers. When I say infotainers, it means that they are providing some kind of health information in a more of entertaining manner. So that's why they have this huge following and people like to listen them and follow them. So when it comes to this scientific world, there was some study done which has shown that uh, social influencers, they can definitely motivate individuals to eat some kind of healthier diet. And the challenge here, or the problem that observed, that was related to the qualification of the influencers, because those influencers were neither a qualified nutritionist or neither qualified or registered dietitians. So this can pose certain kind of problems like false or misleading nutritional information. If it is without any scientific evidence, it can be harmful for the common public, and it can in fact negatively impact the diet or health of the target audience or the common public, because usually these influencers, they are like motivated or inspired by the monetary terms, and when certain kind of organizations pay these kind of influencers, they are ready to promote their product without validating the nutritional value or the authenticity of the products or services. So you can see here that many people are following social influencers, and their like their habits gets motivated or influenced by this kind of social media influencers. So whether it's a family group or peers, office colleagues group, or maybe even healthcare professionals, they can influence, they can get influence. And there are various factors which can influence the level of motivation of the changes in the dietary or the food choices. So there is another scenario where it was observed that some uh, tobacco companies, cigarette companies, these are uh, using the same channels, the social media channels, to promote their product by downsizing or downplaying the risk associated with the e-cigarettes, because they are demonstrating or gathering the influence and impacting the understanding of common people, and they are spreading this wrong philosophy or wrong message that e-cigarettes are much safer as compared to the traditional cigarettes. But the scientific community, doctor and medical community, has taken lots of efforts to stop the negative message related to this kind of bad habits or addictions. But because of the social media, all those efforts are going in vain. You can see here that uh, the social media plays a significant role. Uh, it has shown a significant improvement in uses, in the number of users during the town period of lockdown, the COVID related lockdown, because people were more like having access to the mobiles and the internet. That's why there was sudden surge in the use of social media, and which has largely influenced the habits in good and bad way uh, during those time period. So social media definitely has the potential to reach out the large number of population. So when it comes to social media and the influencer marketing, influencer and targeted marketing in the area of public health, it can be really a good initiative considering the cost effectiveness of this kind of marketing activities, because in a short or a smaller fraction of marketing cost, you can reach out to large number of people, because the influencers already have the fan following, and usually these are typical influencers and they have typical fan following related to a particular or specific health related niche. You can think about say a woman group or maybe older population group. So this kind of group, they have similar kind of health issues, and that's why uh, using these influencers can increase the brand awareness or the awareness related to any new initiatives, public health initiatives or public health programs when they are launched. So in the initial period, they are definitely help to reach out to more number of people, and with the continuous uses, you can see the increase engagement and more interaction with those public health programs or those health initiatives. So in a longer run, you will be able to reach to specific type of population, patient population, and you can expect more credibility from those influencers, because in India there was one campaign which was related to polio vaccination, and the government has used um, movie celebrities to influence the common people, and it was a quite successful campaign in creating that awareness and urgency in the action related to prevention of polio in India, which has helped in the longer run. So when it comes to influencer and targeted marketing, there are certain challenges related to this kind of marketing approaches, because it is dealing with the people. uh, it has there has to be a specific or accurate targeting related to the campaign, because if you are targeting a different product to a completely non-related target audience, then your efforts are going in vain, because it's not going to influence or it is not going to deliver the relevant message to the target population. So when it comes to uh, the quality of the content, it has to be more authentic, because just a few minutes back I told you that some organizations are using the same channels, same marketing tactics to downsize the risk of tobacco. So to counter this kind of efforts, we need to make sure that authentic messages are delivered with the help of this influencer, so that it at the end it reach to the relevant target population, and it improves their health. Here are a few examples that I can think of, which are of more of a public health concern, or maybe even specific disease related concerns. It can be used for substance abuse programs. It can be help in mental health awareness programs. It can be help useful in obesity or diabetes or blood pressure related programs. When it comes to older population, the joint related issues can be a useful campaign which we can think of. So there are various specific programs and general awareness program related to public health, right, related like vaccination or nutrition programs or fitness or exercises campaigns. So this kind of uh, campaigns can be run to solve or target a particular patient or a public population, to solve a particular health issue or health concern. So here are few recommendations I would like to propose from my side. So whenever you are as an individual, as a healthcare practitioner, or as a public health or policy maker, you need to consider this kind of aspects whenever running influencer and targeted marketing campaigns, because the influencer marketing is very powerful. We need to deliver the scientific facts and accurate information, so that it is relevant for the end audience or the consumer of the content, and it is providing the more accurate information to the targeted audience. And when these influencers they are creating content, usually this should go in a more of a educational manner, maybe in the form of some tutorials, some kind of demonstrations, or maybe some case studies. This kind of format can be used for demonstrating or delivering this kind of content. So when it comes to uh, targeted marketing campaigns approach, you can target specific demographics based on their interest, age, gender, or some specific interest groups, so that you can utilize this in a more efficient way with the limited amount of resources. Then you can consider about uh, like these influencers can share their personal experiences, or those influencers can bring or bring potential or existing customers of particular product or services, and they are sharing their personal experiences for the public health benefit. Then this kind of content can be presented in a very humorous manner, in a storytelling format, or some kind of audio visual presentations, so that it will appeal to the target audience. Instead of plain textual data, uh, this kind of engaging format would be more beneficial for the or engaging for the target audience. When it comes to promoting this kind of health initiatives, we need to encourage people to participate in such kind of activities. I have seen various interesting campaigns where social media was utilized for creating awareness related to creating awareness about uh, leg amputation, breast cancer awareness, and the general mass was challenged to participate in this kind of campaigns through their own social profiles. They were asked to perform certain kind of activities or share their thoughts, and this was a kind of viral campaigns which reached out to a larger number of populations. So always try to leverage this kind of influencers because they are more efficient. As I mentioned, they are more of entertainers, and their contents usually get shared to larger amount of population. So we need to leverage this kind of content with the useful information, which is beneficial for the common public. We need to create content around various public health concerns and disease conditions. This kind of topics we can focus one by one, and it will help to break down those barriers and create more understanding, more awareness in the general population. Because when then they come to the healthcare providers, they are already more inspired, more educated, and it makes more easier for the healthcare providers to provide their healthcare services without any kind of obstructions. We need to utilize these influencers, which will create more of inclusive and accessible informations or content in the form of videos, maybe blogs or social media posts, which will be accessible for the common population at any point of time. And this will help to utilize the social media platforms or channels managed by this kind of influencers, which is already being followed by millions of the people. The idea is to just deliver the right message to the right population. So to emphasize more on this aspect, let's look at this survey, this study, which has shown that that almost 57% of US population has uh, changed their perception about medication or treatment based on the social media they were following about. So this itself is become a separate topic for discussion. I leave you with this point just to emphasize on the role of social media and the huge impact of social media and the influencers, not only on the general population, but also on the healthcare providers. So that's all from my side. Thank you for your patient listening. Hope this session was useful, and I have contributed some thought for you. Uh, Looking forward to connect with you soon.